Okay, so the one we will not deal with today is 558. Looks like Senator Perkins Cuoca is working on a solution. We need a solution for next week. If anyone in the audience is working on it, so we'll hold on to that one. We'll just go in order, I think. Senate Bill 354, the cost sharing. I think we have two amendments. The latest one is the February 15th. Have
So I move out to pass?
Senator Avard moves ought to pass.
And
Senator Prentice seconds. Any discussion?
I believe there's an amendment 0726.
That's what I'm going to
I believe-
confirm.
Yeah, sorry about that.
Yep, thank you.
So I move,
0726?
yeah,
Okay.
not sure I know how to discuss it, but somebody else has some information on it. Just need a second?
Oh, I'll second for discussion purposes. Is anyone aware of the amendment and what it basically does? Sure. Okay, I know that there was one amendment that they were working on, but Senator Innes didn't want it brought forward, so,
That was the January one, I
That's-
believe.
yeah.
Okay, so.
Well, no, there was another one after this one, but Senator Innes said no to it.
So this is
I-
our last remaining,
Oh, sorry. I was looking at 93.
okay.
Um,
So my understanding is that this amendment, like on line 7, it shall not apply where there's a generic alternative, so it makes sure that lower cost options are not undermined, if you will.
mhm.
And it also encourages or preserves the carrier's ability to use step therapy protocols, which is an important consideration in managing the costs of the treatment.
And would you conceive this will go to finance?
Yeah, probably.
There's nothing.
I would recommend that it goes to finance so I can hear some of the information. So, any other discussion? Okay.
Is there anyone here who wants to speak to the amendment? I mean, I don't know how this is different, you know.
Matt?
Or
No?
Mike? Do you want, it's up to you, but he might be a good resource.
Do you want to come up and speak on Senator Innes's amendment at all? Sure.
I would like you to.
If you just give us a little snippets.
I don't know. I'd be interested in who worked on the amendment, the major changes, whether all the stakeholders were involved, things like that.
It was really big.
And we're talking about 0726.
Thank you. For the record, Mike Rollo, American Cancer Society Cancer Action Network. I apologize, I did not bring my glasses, so
You want
Mark them?
I might have to borrow them, Senator. So looking at the February 15th version,
Yes.
as Senator Bradley already mentioned, this was includes the generic step therapy, which was a major, well, which is already in state law, but it was something that my organization and several other public health organizations that are part of this coalition are adamantly opposed to. And so we would see that as a concession, actually. But trying to think of who worked on it. All of the groups that I had mentioned at the hearing, I don't have them in front of me, but we did share it with Senator Innes, who shared it with the folks from industry. I don't know. I don't believe they're in support of it. I don't want to speak for them. They can come and speak for themselves. I don't believe they support the amendment, but they were given an opportunity to take a look at it and offer their opinions and other edits. They did offer some. Senator Innes did not support those. So you have what you have in front of you.
Do you support it?
Do we?
Yeah.
Yes, we do, sir. Yes, we do. And it also puts in the section, again, I'm sorry, I'm kind of struggling because I don't have my glasses on. I wasn't planning on speaking this morning, so hopefully these will work.
Yeah,
It's a little better.
I don't have mine.
They do work, actually, they do work a lot better, thank you, sir. I don't care what it looked like. I want to be able to see.
You look great.
I just want to be able to
Great.
see. Okay, so
You are on YouTube.
the section on, I don't care about that. So, on U.S. Code, yeah, so this would also take care of any loopholes under the Affordable Care Act for the U.S. Code 10822C. So that was a problem that we were worried about. So that was put in. We had mentioned that during the hearing. So we were concerned about that, and Senator Innes has made sure that's in there. So we're happy about that as well. So I'm happy to try to answer any questions you may have about the amendment, but I think Senator Bradley actually described it very well. So
Senator Prince?
And I just want, I think Senator Bradley has already touched on this, but just, it's my understanding that one of I don't think that everybody got exactly what they wanted out of this in terms of the negotiation, but the generic alternatives was a big piece of it, correct?
correct,
Is
Senator
that-
Prentice.
Am I correct in that? Okay,
Correct.
thank you.
Senator Bradley had asked us to originally had asked us to craft an amendment that would take care of generics, and that has turned into a tussle back and forth over, I don't even remember when the hearing was at this point. It seems like it was a long time ago, so
24.
January 24th, so it was a bit ago, so, and that does do what we were asked to do, so.
For me,
But it also specifically in that sentence on all three sections allows for prior authorization, step therapy protocol,
Correct.
or an insurer's exceptions and appeals process. So
Correct.
again, I think it is intended to be a compromise, and it also applies to a health savings account high deductible. There was a loophole, as I understand it, that this closes, so.
Senator Whitley, did you have a question?
Just looking at it on line 8, it says a step therapy protocol, comma, or. In the other two instances where it uses that sentence, there isn't the comma after the word protocol. Should there be a committee amendment to put that comma in all three locations?
Probably.
Yeah.
So moved.
Second.
I think,
Good catch.
Yep.
Oh, love that attention to detail, Cam.
Yep.
Exactly.
That's why you're gonna get a big raise.
No,
All right. Thank you, Mike.
with this version 7.7 or something now. Thank you, Cam.
All right. Would the insurance like to come up?
Good morning, Madam Chairman and members of the committee. For the record, my name is Heidi Kroll, and I represent AHIP, America's Health Insurance Plans. I work at Gallagher, Callahan, and Gartrell. I appreciate the opportunity because I know this is unusual to hear comment during an executive session. We do remain opposed to the bill. We appreciate the movement that is reflected in the amendment that you're taking up today. Our concerns remain that coupons and other forms of patient assistance that come from the pharmaceutical manufacturers is a tactic to corner market share and drive consumers toward higher cost brand name drugs when there are lower cost alternatives. And that will have upward pressure on premiums and upward pressure on costs, healthcare costs in the system. So we do, and what we're concerned about is this bill is really not about the use of coupons, but it's about the use of applying patient assistance that's coming from the pharmaceutical manufacturers and applying that to the deductible, which accelerates people faster to meeting their deductibles. And then the cost of higher drugs is then pushed on to all the other premium payers. Our concerns with the particular amendment, we do appreciate that generics have been added. Just to be clear about the references to prior authorization and step therapy and whatnot, we appreciate that we would continue to be able to use that. The reference here in this language is that if someone was on a generic, if there were a generic available, they would not be able to apply the patient assistance to their deductible unless the patient had gone through a prior authorization or step therapy. Then in that case, they would be able to apply the patient assistance to the deductible. So that's what that piece is about. The other language is around the high deductible health plans. That is language that we have elsewhere in statute as well. We need to be very careful. The IRS has very strict rules around the high deductible health plan. And if we create scenarios, we could create a tax liability for patients if we're not careful. So that's what that language is all about. We do remain concerned. There are other types of lower cost alternatives aside from generics, such as biosimilars, therapeutic equivalents, and even combinations of over-the-counter drugs that can be available, that could be substitutes in some cases for brand name drugs. And so we had proposed language that would have added those other types of categories of lower cost alternatives, and those were not accepted by the advocates in Senator Innes. We also had proposed some consumer protections, such as requiring pharmaceutical manufacturers to offer the patient assistance for the full plan year. The tactic is to offer the patient assistance for a limited period of time until the deductible has been reached. And then they withdraw the patient assistance. So we had offered that as a consumer protection, and also more communication with the consumer about how long patient assistance would be made available when patients are making decisions about health plans to choose at the end of the year, when the open enrollment period is happening. We thought it would be important for them to know if the patient assistance is going to be available for the upcoming year. So that's just kind of informed consumer choice. That was not accepted either. And the other piece that we had asked for was communication from the pharmaceutical manufacturers to the extent it's not, all of this, of course, is taking place at the pharmacy, whether it's retail or, remote mail-in. If the pharmacy system if the system that the pharmacy is using between the insurance company and taking patient assistance information from the pharmaceutical manufacturers, if those two systems don't talk, and they don't always talk at the pharmacy level, there's no way for carriers to know if people are actually getting patient assistance. So we're being asked to apply patient assistance to the deductible. We may not have that information. So there's an operational aspect of this, and we had proposed language for that too. So I understand you're here today and you've got this amendment in front of you, but we do remain opposed. We appreciate the movement about the generic piece. The final thing I'll say is that the bill as introduced, and it remains with this amendment, there are some very beneficial programs that the carriers run in conjunction with the patient assistance programs that essentially allows patients to use very expensive brand name drugs for little to no copay. In some cases, zero copay, and that would be eliminated under the bill. So we do have concerns, and I appreciate your time and listening to my comments.
Thank you, Heidi. So the question I have is, I've talked to the Senate President.
Oh, really?
Periodically, I do. And it will be going to Senate Finance. So can we deal with the issues in Senate Finance?
We'd be happy to continue to try to work with the advocates and the sponsor. We've provided language, and that was not received, so.
Okay. Any other? Senator
All I
Bradley?
would say is, I think that when we had this discussion back in January, I had asked for consideration of generic, so that's good. But I think that the parties should get together and try to, define in a way that can go into the bill, lower cost alternatives. And I suspect there are some issues around biologics, but, I think that that was the intent of what I at least was hoping to achieve, but I'm gonna vote for this today. I think it, it's important. I think the rest of this has gone in a way that, your clients, as you just said, are feeling better about, but still can't support. So I think
No, we-
more discussion. about
Again, yeah,
lower
we
cost
do
alternatives.
appreciate the addition of the generics, but there are certainly other pieces that still remain a concern.
Yeah.
And,
all
you know,
right.
at the end
Well,
of the day, it's,
to me, lower cost alternatives is the big issue.
right, we would agree with that. Yes. We want to encourage people to be using lower cost alternative drugs. There are very, very expensive drugs on the market currently. Many, many more very expensive drugs coming down the pike. And the pressure on healthcare costs and premiums and people's deductibles and copays and co-insurances, we really need to drive people toward lower
Well,
cost
the
alternatives.
fact
So-
that, and I don't mean to get argumentative here, that there are biologics coming in the pipeline, these are life-saving cures. And
Absolutely.
you're in the insurance business of trying to protect people's access to healthcare and life. So yes,
Yes.
that is going to drive up the cost, but it is life-saving at the same
Abs-
time. But
Absolutely.
if it's a lower cost alternative that's on the market today, then I think like generics, that's what we're trying to get to.
Right. And if there are biologics that are less expensive than some other brands,
Bingo.
yeah, we would like people to use
So-
those. Absolutely. We do want people to have access to affordable medications. Absolutely. Thank you.
Thank you, Heidi. Okay, so we're at, where are we?
So a committee amendment has been moved to adopt 0726S with the addition of a comma on page 1, line 25, and page 2, line 13.
Very good, Karen. All right, any additional discussion? All those in favor of amendment 0726S, say aye.
Aye.
Opposed?
Move on to pass as amended?
Any additional discussion? All those in favor of ought to pass as amended, on Senate Bill, Senate Bill 354, say aye.
Aye.
Opposed?
Consent?
Second.
All those in favor of consent, say aye.
Aye.
All right. Kevin, you want to take this out? Senator Abar will take it out. Next is 400. Madam-
World War IV, that one?
Yeah, pretty much.
I move on to pass?
Second.
Oh, 400.
Okay. I do have an amendment, on 400, which is reducing the reducing the cost. You were
Yeah,
again.
you had it.
1249S, that brings the cost of an electronic copy to $6.50, and the cost of paper copies shall not exceed $5 for the first page, 41 cents per page, to not to exceed a total cost of $50. That is my amendment. Now, I know that in other states, other states have passed the same type of bill, but at $30. They reduced it down to $30 for copies. So we're $20 more than some of the other states that have passed this bill. So yes.
Thank you, Senator Bertzel. So setting the paper copies aside, so the electronic copies shall not exceed $6.50.
Oh,
Yeah.
you know what? Can I wanted to withdraw my motion about the passing.
All right, I'll move on to pass then.
I'll second. Go ahead, Senator Bernice.
Thank you, and
You got out of bed on the wrong.
I got out of bed.
All right.
Sorry.
My
thank
fault.
you,
Stick
thank you,
with the discussion,
Senator Bertzel. So,
okay?
and I've been clear all along in my concern and opposition to this, and have been really respectful of the work that's been done and understand the intent. I actually have handled medical records, and when they were paper, as well as the electronic version, and understand that there is a missing level of interoperability. So it is not as simple as the press of a button, that there is labor behind this. And I want to, and I've spoken, I have one major health system in my district, and then I have a smaller hospital, but I've gathered together a list of the other smaller hospitals that use this as a service. So my opposition to this is in protecting that ability for them to use this as a cost-effective service so they can put more of their dollars towards providing patient care. But I've expressed my concern and my thanks for your work on it. And I was just surprised to see it come down to $6.50. I thought we were someplace else. So, okay. Thank you, Senator Bertzel.
Thank you, Madam Chair. I understand the balance of interest here. I just feel like, these are patients' medical records. And if the patient requests it, I don't think it should be any different than if their attorney, who's their representative, it's their record. So I am supportive of both the bill and the amendment.
Well, and I would remind everyone that when someone, let's say an attorney, requests the records, it's with a signature of the patient requesting the record. If the patient themselves had gone in and requested it, it would be $0. Keep in mind that patient is eventually, at the end of whatever case that is, they're going to be billed for that. So they're paying for their own medical records because the attorneys will charge them. So,
I do believe that the hospital association did come out and say that they were opposed to this as well, and that if they lost that third party, that it would be very hard for them to staff that.
but every state that has passed this similar bill at $30 have not lost businesses. And keep in mind, what are they doing? What are these third parties doing with some of our medical information? I'm concerned about that as well.
Was
But
there an amendment to go along with this?
this is the amendment.
That is the amendment. Yeah.
So, all right. I will move Amendment 1249S.
Second.
Any additional discussion? All those in favor of Amendment 1249S, say aye. Aye. Opposed?
No,
No.
I'll move,
Can I propose a second amendment? If you look at the bill. I had it here a minute ago.
you handed us earlier?
I want to propose a further, it's just to change the effective date to, from 60 days to January 1st of next year.
I can second that.
I think there's gonna be a change in if this passes and how it's implemented. I think that's just a fairness issue.
and I'm going to vote against this particular amendment for personal reasons.
She talks to the Senate president.
Yeah, she does.
Trust me, I talked to the individual too. So, all right. All those in favor of, what number is it?
That's a committee amendment.
Oh,
It just changes the effective date in the bill. It's not in the amendment. It would
Okay.
change the effective date to.
so all
January
those in
1st.
favor of the committee amendments, say aye.
Aye.
Opposed, nay. You said nay?
I said no.
Oh.
Don't you talk to me?
Three, two again.
Different 3-2 though.
Yes.
It's bipartisan.
Whatever.
All those,
I'll move on to pass as amended.
Second.
all those in favor of, ought to pass as amended on Senate Bill 400, say aye.
Aye.
Opposed?
No.
No.
Okay, I will take it out. All right. 406.
Madam
Another
Chair,
one
can I
that
go
has never-ending amendments.
Madam Chair, may I request a brief caucus?
Sure. We will,
1, 2, 5, 3.
We have 2 amendments.
Yeah.
No, 3 amendments. 3 amendments. 1, 2, 5, 3.
wait, what? 1244?
1, 2, 5, 3. And 1, 0, the other.
There it is.
And 1, 0, 0,
Oh
6.
my goodness. All right, we will be in recess. We are back in executive session and Senate Bill 406. Okay, I'll second for discussion. I know there are two amendments. Do you want to,
Want me to move them? One of them?
one of them?
Yes, I'm gonna move them. I'm gonna slow myself down, Cam. Thank you. I would move amendment 2024-1253. Nope,
You want to move 1006?
1006.
Second.
Yeah. Okay.
And,
There's three of them. I have them in order.
no, there's only two.
I've got 406.
And I'd like to speak to the motion.
Go ahead.
Thank you.
I would too.
So, I really commend Senator Fenton for bringing forth this bill. This issue is beyond an emergency. We have municipalities that are required essentially to do the right thing. They are, required by law to make sure folks are housed. But the reality is that town budgets are being busted right now. And we all know that when town budgets are busted, property taxes are impacted. And so Senator Fenton introduced a bill to truly address the upstream problem, which was incredibly important. And unfortunately, looking at the other amendment, it really puts a Band-Aid on a bullet hole. It does not address the upstream problem. The other amendment will not create additional beds, which is what are absolutely critical to lowering property taxes, supporting our municipalities. So that's why I really hope that our colleagues can support 1006 to support our local municipalities and our unhoused folks.
All right, any other?
So, not to be disagreeable,
But to be disagreeable.
or even to disagree, but I'm gonna disagree. I think it was in 2022, Senator Khan and I worked on something similar to this that would have dedicated surplus dollars to housing initiatives by municipalities. There was a trigger mechanism in it that prioritized the money based on the number of Medicaid recipients in any given town. Passed the Senate, it was $5 million appropriation, and it foundered in, excuse me, a committee of conference. So sympathetic to, what towns are going through. No question about it, because in my district, towns are having to put people in hotel rooms if they have no access to shelters. And I believe there are only 13 or 14 shelters in New Hampshire. So while I'm sympathetic, I also know, and having met with shelters, that even though we raised the bed price in the budget to $20, one shelter in particular has told me that they cannot possibly stay open 12 months a year and provide the services that they're providing now if this funding doesn't happen. So this funding, I shouldn't be speaking to my amendment. I will when we get there, if we get there. So while this funding would be helpful, I think it's actually going to create a bigger problem by not funding the existing shelters. So I can't support Amendment 1006. It's a new program. I think, as you just accurately surmised, and the problem is significant, but I think the problem for the existing shelters outweighs the need for a new program. So I can't support this.
Senator Prentice?
Thank you very much, Chair Birdsall. And yes, so I am on 1006. And so Senator Bradley, thank you for what you just said. I'm going to address that in a moment. But being a former city councilor, we on an annual basis knew that we were the point of last resort. You know, that if families and individuals needed services and, you know, we'd already spent our human services budget on helping them and worked with our not-for-profits, we had to find a way. And so we ultimately had to do this. And we didn't have the kind of flexibility that I believe that this amendment, and for what it was initially intended to do, was to get the maximum flexibility of the municipalities to do the kind of work to support folks that need a roof over their head. My understanding on the shelter, so I'm pro maximum flexibility. I am pro letting the municipalities who end up being that place of last resort make those decisions. And in fact, in the city of Lebanon, we just opened up our first, at least it's a wintertime shelter. And we're using, you know, a combination of city dollars and not-for-profit dollars to pull this together, that we actually had to bring through into a budget that we hadn't initially planned. So maximum flexibility, let the municipal governments who are that point of last resort do their job. But here's where I think maybe, and Senator Bradley, and if I'm incorrect, please help me out with this. If we were to move the money through the municipalities, is there anything in there that doesn't allow them to coordinate with the shelters and bring some of this funding to the shelters?
So
If that was,
There's no problem.
presumably, that could, I suppose, happen if a community did receive money. But what I would, I hate it when my phone rings,
There is no prohibition.
on the phone ringing.
well, that too.
There should be, but now I just can shut it off on my watch. It's pretty cool.
That is pretty cool.
Yeah, for a technophobe like me. There would be no prohibition on it, but I think the issue is we're potentially gonna have existing shelters closing for part of the year at a minimum because they're just not able to make ends meet. And to me, that is a higher priority of limited dollars to be able to fund. Finance just passed yesterday your hunger bill. And I think finance also just passed, I don't think, I know, the $60 million appropriation for the Sununu Youth Center yesterday. So the amount of money that we're going to have is pretty limited at this point. And so to me, we have to prioritize. And I think if existing shelters close because of lack of funding, that is, at least in the way I look at it, a higher priority than creating, you know, a new initiative. The other thing I would add is for a town like Lebanon, we dedicated, I believe it was $2 million in the budget to go through the CAP program for cold weather grants and homeless
That's perfect,
grants
yep.
last year in the budget.
Mhm.
So there was some additional
Yes,
assistance.
there was. It's not all
so
the
I-
taxpayers.
I-
I understand.
I just, as we're looking at a limited amount of money in a non-budget year, especially given the YDC issue that's gonna consume everything, my view is we need to prioritize the existing shelters to make sure they stay open.
So just a quick follow-up. May I?
Yeah, go ahead.
Actually, Senator Bradley, I think we can do both with this. And maybe, I don't know if it's a tinkering of the language, but I don't see, I'm sensitive to the fact that the shelters are struggling and and that, you know, and many of them are actually full. So we're not, you know, that becomes a problem in itself, but could we accomplish both by giving the maximum flexibility to municipalities, but asking them to prioritize on the shelter side first? Because is there a way to
If
do
the-
both?
You know, I struggled with this, ask Kate, because, you know, I had that amendment from 2022 dragged up, read it, it's in one of my folders somewhere, but, you know, after meeting with one of the shelters who flat out said they were likely to have to close from, June to October. It just, you know, seems to me that the priority has to be existing beds. Would we like to create more beds? Absolutely, but, we're being dwarfed by the Sununu Center settlement issue and other priorities that I think, you know, we're gonna see from the House on Group 2 retirement. So
Madam Chair?
that's the problem.
Okay,
We're in
thank you.
executive session, and we don't have to, I don't have to call on people.
Right, so what I would say is, I hear what Senator Bradley is saying, that, we need to both take care of the existing shelters and also create the additional beds. I think 1006 accomplish it. It's a both and. No one disagrees with that, and I don't think we should be at this point. My other thing is, why don't I hear what you're saying about the fiscal considerations in a non-budget year? I absolutely hear you. And also, we're a policy committee. So I don't want to be put in a place in a policy committee to, pick hungry kids over housing. Like, I don't want to do that. We're a policy committee. I think if we want to make a policy statement that we need to support our municipalities, we need to support the unhoused, I think that we should do that. And then let finance do the job. Senator Birdsell, Senator Bradley, you are on finance. That's certainly, you will have that conversation with balancing the various financial considerations. But I think as a policy interest, I think this committee should, recognize that both issues are a problem and that we want to address them. So that would be my suggestion.
Are we ready for a vote, or did?
Or do you want to entertain maybe a committee amendment that uses 106 as the vehicle and prioritizes what I'm looking at?
Oh.
No, because
Sorry.
as I understand it, they're different distribution mechanisms. By doing the 1253 amendment, it dedicates the $2.5 million to the department for the purposes of increasing rates. Okay, so that's through, I've forgotten the acronym, but there is a SGIA,
A.
state.
State
State government and
and
aid.
All right. And so if we mix and match, then we're not gonna have enough money for the shelters. And if we, it's already gonna be a struggle with some of the things that we're trying to fund, and starting with, we've already done the firefighter screening, cancer firefighter screening.
Correct. Yep.
I hope that tomorrow we do Senate Bill 499, your bill. But I'm getting questions on that from my colleagues. So, that's why I don't think we can do $5 million and support that. And I'd just soon make that decision, that this is in a very tough situation where we should prioritize. But I understand this, and I worked with Senator Khan 2 years ago on exactly this
Yeah,
type of thing.
Any additional discussion? Seeing none, we'll move to the vote. All those in favor of amendment 1006S, say aye.
I
Opposed?
No.
Nay.
No,
So the amendment fails.
I'll move Amendment 1253.
I'll second. Would you like to speak to your amendment? Although you probably
I
already.
think I've already spoken to them.
All right. Any additional discussions?
Yeah, I will just say, I appreciate the support for existing shelters. I just can't support any amendment that doesn't give municipalities the necessary relief for additional beds.
Well, I believe that actually this amendment will allow the municipality shelters to, will help the municipality-owned shelters. It may not add beds, but it will give them additional money.
Yeah, so again, I'm glad that we're preserving, allowing the shelters to keep existing beds. Absolutely, I'm supportive of that, but I cannot support an amendment that removes the necessary support for municipalities to add additional beds when the need is so significant. And again, I think it's a policy issue. I recognize the financial considerations, but we're a policy committee, and so as a member of a policy committee, I can't support this amendment.
Well, and I think as a policy committee, we have to be concerned about the existing shelters. To me, that should be priority versus starting a new program. We need to make sure that the shelters that are already in place have the capability of staying in business. So, any other discussion?
Just simply say that I appreciate everything that's been brought to the table. I just feel that we're missing some opportunity to consolidate this effort. And I understand that there's different amounts, and I think that that's negotiable. And I know we're the policy committee, and, new program versus existing program. I just really feel like we're missing an opportunity to even do a Bradley special, to do both here.
Apprentice special.
So.
Bradley special.
Apprentice Bradley special.
Yeah. Because, it could be nothing too.
That is true. It could be nothing, but
That
I
wouldn't
will,
be special.
and that would not be
That's
special.
why it's not.
So I'm just gonna bring my municipal voice to the table and say, I appreciate this. I'm gonna, not support this amendment for that reason. And it's not that I don't want to support existing shelters. I just want a better package. That's all. Policy package. Thank you.
All right. All those in favor of Amendment 1253S, say aye.
Aye.
Opposed?
No.
Want to pass as amended?
I'll second. Ought to pass as amended. All those in favor of ought to pass as amended on Senate Bill 406, say aye.
Aye.
Opposed?
Consent?
Do we want to do consent? I'll second. All those in favor of consent, say aye.
Aye.
No.
Okay. So, the vote is 5-0.
I think so. Whitley said no.
Well, she did.
I said no on consent.
On consent, but
Correct.
Yes
Um,
on the bill.
yes on the bill.
No.
Yes on the bill. No.
Right. I will take that out. Hmm. Senate Bill 411, and we have amendments on that one.
I move on to pass on 411.
I'll second. Any discussion? There's an amendment, 1240S.
I'll
Yeah.
move. Yep. 1240. Yes.
Okay.
So I will say, I
This
just
is a
want to.
Bradley Whitley special.
I always advocate for a Whitley Bradley special, but never goes for that.
You gotta go for alphabetical order.
Oh, there you go. I just want to thank all the parties.
Yeah. I have two.
Maybe that's what happened.
3 amendments for the last.
I know.
I just wanted to thank all the parties for their work on this. This is such an important issue. We continue to have a very acute children's mental health crisis. And so I do thank all the parties for coming to the table. I think there are some carriers that were really strong partners. Not all carriers were. I just want to say that, some were incredible and really are being solutions oriented about that. And I really appreciate that. We're not quite there, right? I don't think that we have all carriers with a commitment. And so that's why I think we need to keep talking about this issue. I want to thank the Department of Insurance for their incredible work and commitment to making sure kids get what they need and continued commitment. I hear from them that continued commitment. So because it's such an important issue, we need to keep talking about it. I think retaining a study committee is really important to making sure we're having that parity and keeping folks at the table. So I appreciate
And we still have the draft bulletin that the insurance department
Yep.
put out, so that's a plus.
Yep.
Senator Bradley?
Yeah, like Senator Whitley, I think a lot of good work's been done. Credit to DJ, but also credit to the carriers. So the question that remains is what's called the Fast Forward program, which, as has been explained to me, needs to come into network in order to have those services have a code for billing. The study language gives the carriers, the department, and the providers an opportunity to continue to work to bring Fast Forward in under the umbrella and have CPT codes so that it's reimbursable. I think that's given the goodwill that's been established by the carriers, by the department, by the sponsor, this is a way of proceeding to try to make sure that we can close this last gap on Fast Forward. So hats off to everybody, and I think this is a great way to proceed.
Any other comments?
Do you have a second on the
Yeah, me.
All right. All those in favor of Amendment 1240S, say aye.
Aye.
Opposed?
amendment?
Second.
Okay. All those in favor of ought to pass as amended on Senate Bill 411, say aye.
Aye.
Aye. Opposed? Do we want consent?
Yeah, that's fine.
Second.
Okay. All those in favor of consent, say aye.
Aye.
Opposed? Senator Whitley, would you like to take this on? Okay. Last but not least, we won't be doing, excuse me, we won't be doing the House bills. The Senate President has determined that we need to get through all of the Senate bills before we start execing the House bills. We can hear them, but we can't exec them. Do we have any, by the way?
Yeah, we got two.
Okay,
558. 558, 101.
all right. So 556 is our last but not least.
Thank you, Senator Birdsall.
Second.
Thank you. So, first of all, at our initial hearing, we had carriers, although they weren't in complete agreement. So this is about this is about parity in pay, not just for the services that are covered by nurse practitioners. And what I was really grateful that all the carriers came to the table and continued to work on this throughout the process. We just couldn't get to the place where we couldn't get to 100% consensus on the carrier side. So I'm coming into this and saying that we don't have 100% consensus from the carriers, that it'll be pay equity at 100% for primary care and for behavioral health. We did change the section of statute that this primarily falls under. So before, it was more tailored to the insurance statute. Here, it's in the Nurse Practice Act. So I appreciated the collaboration. We just were not able to get there.
Are we on
Senator
the amendment?
Avard, you look like you have a.
Yeah, we're on the amendment.
We're on
right?
the amendment. Yeah, we're on the amendment.
Okay, do we move the
Oh.
amendment?
Oh,
We need to move. What?
Jesus, Mary and Joseph.
I move 1239S.
I'll second for discussion.
And everything I already said.
Yeah.
But the bill, the focus here is because of the primary care shortage and behavioral health to improve the workforce by supporting the nurse practitioners through not just the services that they are covered, but payment parity. That's it. So, and everything I said about cooperation and, hard work during this, we just weren't able to get there. So I'm coming forward with this, and hopefully we can do it.
Okay.
So it's, the amendment's 1, 2, 3. no.
1239, right?
Yeah.
Okay. Any additional discussion? Yes.
Um, I support the goal of this, but I'm not sure that 100% parity is the right answer. So I'm going to be a no vote on the amendment. As I recall, and I have too many balls in the air, but you had a provision in your ambulance bill that was, I think, an 80% reimbursement off of, was it something else or was
So-
it this bill?
It's this bill. So the federal, the majority of insurance carriers in the state, and certainly the carriers that are here can correct me if I'm wrong, reimburse at 85% of Medicare for nurse practitioners.
Yeah.
So that wasn't in the ambulance bill. That was part of the testimony that came in, and I actually brought that forward and said, what we have right now is 85%. What we'd like to do is increase it to 100 because they are providing, from a primary care and behavioral health perspective, the same services. So it was separate from ambulance. That is, the majority are providing at 85%.
I guess I just feel that physicians and nurses ought to be able to bill similar, but not exactly the same. So it's okay, but I'm not going to jump up and down about it.
Okay. All right. All those are we ready for a vote?
On the amendment?
All those in favor of Amendment 1239S, say aye. Opposed?
Opposed.
So we're about to pass this
Okay,
amended.
4-1. I'm sorry? Ought-
I'm about to pass this amended.
I'll second. All those in favor of ought to pass as amended on Senate Bill 556, say aye. Aye. Opposed? Okay. Senator Prentice, would you like to take this one out?
I will. Thank you.
So, any additional discussions before because we're done? Senate bill. Oh, except for Rebecca's. 8. I know. It's either going to be an amendment or it's going to be interim study. So whoever sees her first, let her know.
Yeah. So she has been trying to
I know
work
she's
very
close.
hard. Yeah, and they're very close. And she has assured us by next week she'll be ready.
Okay,
Motion to move out of exec?
I'll second. All those in favor say aye.
Aye.
Opposed? Okay. How many bills do we have next?
We have 12 total House bills. We've heard 2, so we have 10 left.
We'll be meeting next week.
Next week?